Well, hello there, Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. The worst name for a podcast ever. But if you live in Stanford, Darien, Norwalk, New Canaan, you need someone who's just not just a chiropractor, then perhaps it's not that bad. Well, I'm asking you to put up with it for my sake. All right. Frozen shoulder. Let's go over the questions for frozen shoulder. What is the main cause of frozen shoulder? Well, of course, I get these questions. Is there a food that causes frozen shoulder? No. Is frozen shoulder related to stress? Physical stress, yes. And that's kind of it. So the main cause of frozen shoulder could be a trauma, um, more of of a chronic nature, something that didn't get healed. You could have an irritated nerve root in the cervical spine. And basically, I mean, the C5, C6 nerve goes to just about every nerve and every muscle in the shoulder. So if you have some trauma to C5, C6, yeah, I think you can really have a an issue there. So if there's an irritation of that nerve root, it's pretty possible to have a frozen shoulder because the nerves are not getting the stimulation because being blocked at the C5, C6 IVF. All right, so that's one thing. Fastest way to get rid of a frozen shoulder is to, well, call me, 203-656-3636. Now that's pretty self-serving, but yeah, I had to throw that one in there. But the fastest way to get rid of a frozen shoulder is, people that think like a cream, a CBD doesn't really work. I mean, what it comes down to is you gotta nail the muscles that are involved and identifying those muscles. The first thing is, so you gotta make sure who's ever treating you is going to do a really solid, go through all the different muscles. I mean, let's think about it. You got the supraspinatus, infraspinatus, teres major, teres minor. You have the subscapularis. You have all three heads of the deltoid, the triceps, and also too with shoulder pain, you got to check the pectoral muscles. I mean, so these three heads of the pectoral muscles that insert onto the shoulder. So you probably got to pay attention to that as well. So, but the fastest way I think to get rid of it is identify the muscle groups, and primarily we're going to see the supraspinatus, the middle deltoid, subscapularis, and lat. And you got to determine if those muscles are weak or short. Now, I'm talking about the fastest way, and the majority of the time. There's always going to be exceptions to the rule, but this is something that I think you would benefit from is the proper exam. I mean, it's like okay, I also use shockwave therapy. It's a great way for making muscles, adhesions go away because if a muscle's not getting the right intervention, right? What tends to happen is you get these adhesions, and adhesions are really painful things. And what I refer to an adhesion is think about a grape and a raisin, kind of the same, just a little bit different. One's dried out and one's not. Well, if the muscle's supposed to be like a grape and it's acting like a raisin, what has to happen is you got to infuse fluid into the thing, obviously, but the tissue is so dehydrated there's ways to break up those adhesions, and we use it, shockwave therapy, and then everybody's calling it different things like wave therapy, but it's it's a pneumatic machine. It's been used in orthopedic now for several years. I'm a big fan of it myself. As any soft tissue injury, because you can stimulate blood flow, so that blood flow will help rehydrate the grape or the raisin into the grape. Um, it also stimulates nerve flow as well, but it breaks up the adhesions in the fascia, which is the covering on the muscle. So again, we got to hit the lat, supraspinatus, middle deltoid, and the subscapularis. Those are the primary drivers. And when you get out of balance, you have one muscle overworking, and there's a big balance. The shoulder is really held in there with a couple of ligaments and all these muscles, and it's kind of it's pretty important to get the good exam. The good exam is really important. I mean, people just take an MRI of your shoulder, and the guy looks at, well, I can't find anything. He has to go to physical therapy. You're not going to really be served as well. I mean, it really comes down to um, a good exam. So, as it should always. But when you identify a short or weak muscle, then you have to fix them. Okay, and so what we're doing is we're working with a thing called Golgi tendon organs, for tendon, and we'll look at muscle spindle cells for muscle. But the important thing to know is that how these things affect the brain, the pattern in the brain, because if you're not sending the proper signals, okay, the signal, say, from the muscle spindle cell, let's say it's supraspinatus, aberrant signals are going up, so they're not getting to your brain properly. They have to go to the spinal cord, they synapse, and actually, when these things are firing properly, the muscle spindle cells and the Golgi tendon organs, they actually inhibit pain. When you're having pain, they're not being stimulated. So it's a way of like, duh, you have a problem here, and Advil's just not going to fix it. I can tell you that much. You can rub all creams and, like I said, CBD and icy hot on it. It's not going to do jack for it. But if we can fix those muscle spindle cells and reopen up the signaling, the afferent signaling to the spinal cord, which then goes up to the cerebellum and then up to the opposite side of your brain, you can get a better, faster healing. So, faster way to heal it is one, get a good examination, a solid examination. MRI is not solid enough of an exam. It's not a bad thing to have, but it's going to tell you have tears. That's what you're looking for. Because if it's a tear, then maybe you can't fix it, and it is a surgical resolution. But if you can identify the muscles with a good exam, you use shockwave therapy to break up the adhesions, and then you also identify which muscles are short and weak and correct that, you're going to see a faster healing response. And that's basically what we do here at Core Health. So, yeah, it's a shameless plug for what we do, but frozen shoulders, it's a thing most people don't know how to really treat. I mean, you can go in and get a cortisone injection. It doesn't, it's just not, doesn't work. I mean, cortisone is the answer. Well, it's going to take out some of the swelling. It's not going to get you to move your arm better. It's going to take out some of the swelling, but usually it's short lived, especially, if you have irritation of the nerve root, C5, C6 nerve root. Does a frozen shoulder ever go back to normal? Yeah, it does. It can. But sometimes it lasts a long time if you just do regular physical therapy. You know, and I'm not saying chiropractors alone, just good physical therapists out there who can make a big difference. Can you stop a frozen shoulder from getting worse? It's one of the other questions we just got. Well, you can if you identify it and hit it sooner rather than later. The longer you let it go, the more the muscles, the balance between agonistic and antagonistic muscle groups is going to be in play there. This is actually, what treatment's best for frozen shoulder. Is it okay to massage a frozen shoulder? Yeah, yeah, it's okay. It'll feel good. Should have a mobility. I mean, massage isn't going to really be bad for anything. So if it's okay to massage, hell yeah. It's okay to get a massage any day of the week. What should you avoid with frozen shoulder? That's a good question. I would say golf, tennis, racket sports. Probably, there's a lot of exercise that really use the shoulder. And again, look at this. Somebody stuck this other question: can stress cause frozen shoulder? A physical stress, yeah. Mental stress for frozen shoulder. I'm gonna go with a big no. You know, Here's another one: does frozen shoulder ever go away? Yeah, it does. It does. It doesn't just mysteriously go away on its own. You'd be surprised at how long people can think they can survive with it. Um, is heat better for frozen shoulder? I would say yeah, because anytime you have a chronic condition, heat's going to be you know, it brings blood flow to the area. So anytime you bring blood flow, but now the shockwave therapy also stimulates blood flow like on a hyper level. So I would definitely think you might want to consider, treating it with that particular way of going, for the shockwave. But heat as well is very good. The two, you know what? I should backtrack. Laser, near and far infrared light therapy would be another strong player here. I could see that being a very good thing too, because the light therapy has vasodilation, which again opens up blood vessels. You want the blood vessels open, again to get hydration and get that. Again, we're going from a raisin to back to a grape. What are the four stages of frozen shoulder? I guess pain, poor sleeping, because when you turn at night, lack of exercise, crankiness. So the exact four stages, I can't answer that one. Okay. Um, the keep sentence one is about stress. No, it is not a stressful situation. I gotta limit my questions, but I keep getting the same one. Well, X-rays show frozen shoulder. That's a good question. Not necessarily, because it's more of a soft tissue injury, either, again due to the weakness or shortening of certain muscles. And this is a valid question here. What is a natural remedy for frozen shoulder? I don't really know if there is one. I mean, again, people think CBD is natural, and it's you know, is there a natural remedy? I don't think so. I mean, there's some stretching you can do at home, but if you don't balance out those muscles, because you have to understand there's a relationship in the shoulder with agonistic and antagonistic muscle groups. It's very easy for people to understand the bicep tricep relationship. If your biceps contracted, the triceps relaxed. The triceps contracted, the biceps relaxed. Well, this exists with the different muscles in the shoulder. That's probably a much longer topic for another day. You know, and here's what foods should you avoid with frozen shoulder? Um, I guess you should just avoid the standard American diet, which is going to kill you anyhow, the way it is these days with processed food, the bad fats that it has in it, the sugar, the white flour. So, so, so again, I don't think food's going to kill you when you have a frozen shoulder, but the food can kill you regardless as far as it relates to your overall lifestyle. Well, here's the question is frozen shoulder, can it be helped? Yes. We've been doing a damn good job of helping in core health for a number of years. Oh, wait a second. I did skip a part here, and this is an interesting thing. Blood flow restriction. Blood flow restriction is a very good way to get more blood flow. You want okay. Once you fix the muscle, right? I mean, trigenics is a great way to identify whether or not you have the muscle short and weak. Shockwave is a great way to break the adhesions. Um, but if you do blood flow restrictions, where you would actually put a restrictive elastic band at the axilla, the armpit, and you would do certain exercises. And here's the thing is, you only do about 40% of your max. So it's just theoretically, say you could curl 100 pounds, but you would only do 40 pounds. And you would do 30 reps, 15 seconds off, 15 reps, 15 seconds, 15, 15, 15, 15. So all in all, you're doing 65, right? 45 and 30, or 70, 75 reps at a lower, much lower rate. What happens is that deficit of the blood that causes when you stop doing the exercise, it engorges the muscles. So you're really getting a big blood flow in, which is going to heal. I mean, the blood is what heals everything. Basically, it brings the nutrients, it brings the warmth, the healing. Everything you need for it to heal past when you relieve the physical limitations from the short muscles and the weak muscles. It's a really powerful way and a much faster way because a bad frozen shoulder can last for. I mean, you can have a frozen shoulder for years. I mean, some people just learn to live with it. They can move their shoulders somewhat, and okay, that keeps them happy. Well, they're not calling me to fix it. All right, so listen, frozen shoulder can be helped. Main cause, usually some kind of impingement. You know, the fastest way to get rid of frozen shoulder, 203-656-3636. What's the best treatment for frozen shoulder? Well, first thing is a good exam. Number two, shockwave therapy. And again, it's just harped on blood flow restriction, but also trigenics to balance out those weak and short muscles. All right, Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. If you got any questions, again, 203-656-3636. Listen, thanks for listening. I hope you found it to be informative. If you have any topics you'd like me to discuss, send it over to me. All right, thanks. Bye, and have a great day.